Cancer can be a scary thing that impacts families around the world. But the good news is, if we catch it early, many cancers can be treated successfully. In Australia, you can get screened for breast, bowel and cervical cancer. Regular screening for these 3 cancers can help find cancer before we feel any symptoms or see any signs. Bowel, breast and cervical cancers can affect everyone, but some people are more at risk than others. Things like age, gender, family history, obesity, or some habits like smoking can increase your risk for some cancers. Remember, some cancers are preventable and many are treatable, so don't hesitate. Go and get checked. It's easy. Just speak to your GP if you aren't sure. Now let's look at national screening programs available in Australia. Bowel cancer. Bowel cancer can develop without any warning signs or symptoms. The cancer can grow inside the bowel for many years before it is detected. This is why screening is so important. For bowel cancer, age is the biggest risk factor and can affect people even if they feel healthy. In Australia, Medicare-eligible people aged 45 to 74 can do a free bowel cancer screening test every 2 years. If you're between 45 and 49, you'll need to request your first screening kit. For those aged 50 and older, you will automatically receive a free screening kit every 2 years in the post. The test looks for invisible traces of blood in your poo, which could be a sign of cancer. All you need to do is collect 2 tiny samples from 2 separate poos. Bowel cancer screening saves lives by catching cancer early. If you're eligible but haven't received your screening kit, ask your GP or call 1-800-627-701 to get tested. Taking care of your health means looking after yourself and your loved ones. Encourage your friends and family to get screened too. Let's all do the test for a healthier community. Breast cancer. As you age, the risk of breast cancer increases. Finding it early makes treatment easier and improves your chances of living a healthy life. Women aged 50 to 74 should get screened every 2 years. Breast screen is also called a mammogram. This test can find breast cancer before any signs show, even before you can feel it. A breast screen is safe, confidential, and is free if you have a Medicare card. During the test, X-rays of each breast are taken. Your breast will be compressed for about 10 seconds, causing some pressure, but should not be painful. Afterward, trained medical professionals will review your X-rays. You and your GP will get your test results in about 2 weeks. Women should get screened every 2 years to stay healthy for you, for your family, and for your community. To get a test, talk to your GP or call 13 20 50 to make a booking at your local breast screen clinic or mobile clinic when it visits your community. For more information or to book your screening, contact Breast Screen Australia today. Cervical cancer. Cervical cancer is one of the most preventable cancers. It develops on the cervix, the area between the uterus and vagina. The human papillomavirus, HPV, can lead to cervical cancer, and regular screenings every 5 years detect them. Many people have HPV without knowing it, and nearly all women will have it at least once in their life. HPV often shows no symptoms, and the body clears it on its own. However, if HPV isn't cleared, it can cause abnormal cervical cell changes that may lead to cancer if left untreated. To screen for cervical cancer, visit your doctor or nurse for an appointment. If you need an interpreter, ask for one. Their services are available free of charge. During your appointment, your GP will use a brush to take a sample, which may feel uncomfortable but shouldn't be painful. If your GP isn't a female, you can ask for a female to do your test. Alternatively, you can use a self-collection swab provided by your healthcare provider. They'll explain how to use it. You'll have a private space and they can assist if needed. Let's take charge of our health. Check to see if you're due for a screening today and encourage others in our community to do the same. Together, we can prevent cervical cancer by prioritising our well-being. Cancer screening isn't just about staying healthy for you, it's about the well-being of our whole community, and something we should all prioritise no matter how we feel. Don't wait until you're sick. Screening finds issues early so we can get treated and stay healthy. Even if a screening result is positive, you can get treatment. Finding cancer early leads to better outcomes. If you have questions or concerns, don't hesitate to ask your GP or health provider. It's okay to ask for help in your language or request a provider of your gender for comfort. Let's spread the word about screening to prevent cancer and maintain health in our community. Let's work together to prioritise our community's health.